Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on mechanisms of inflammation and tissue repair, with 4 answer choices and explanations. Mechanisms of inflammation and tissue repair. 1. Acute inflammation, neutrophil response. A 25-year-old male steps on a rusty nail and develops redness, swelling, and pain at the injury site within hours. Which of the following is the first immune cell to arrive at the site? A. Macrophages, B. Neutrophils, C. T cells, D. eosinophils. Answer B. Neutrophils. Explanation. Neutrophils are the first responders in acute inflammation, recruited by IL-8 and C5a. They phagocytose bacteria and release reactive oxygen species. Vascular changes in inflammation. A 30-year-old woman with a bee sting on her forearm notices localized swelling and warmth. Which of the following mediators primarily causes increased vascular permeability? A. Histamine, B. Interleukin-1, C. Interferon gamma, D. Transforming growth factor beta, TGF-beta. Answer. A. Histamine. Explanation. Histamine, released from mast cells, increases vascular permeability and vasodilation, contributing to edema and erythema. 3. Chronic inflammation, macrophage role. A 55-year-old man with a long history of tuberculosis has a lung biopsy that shows epithelioid macrophages and multinucleated giant cells forming granulomas. Which cytokine is most responsible for macrophage activation? A. Interferon gamma, IFN-Guang, B. Interleukin-10, IL-10, C. Interleukin-4, IL-4, D. Tumor necrosis factor alpha, TNFA. Answer A. Interferon gamma, IFN-Guang. Explanation. Secreted by T-helper 1, Th1 cells, activates macrophages, promoting granuloma formation in chronic infections like tuberculosis. Anna 4. Leukocyte extravasation. A 40-year-old woman with an acute bacterial infection shows high neutrophil counts. The first step in neutrophil migration from blood vessels to tissues involves A. Rolling, B. Tight adhesion, C. Diapedesis, D. Chemotaxis. Explanation. Neutrophils roll along endothelial cells using selectins before firmly adhering and migrating into tissues. 5. Chronic wound, impaired healing in diabetes. A 68-year-old diabetic man develops a non-healing foot ulcer despite treatment. What is the most likely reason for his delayed wound healing? A. Excess collagen deposition, B. Increased fibroblast proliferation, C. Decreased angiogenesis and immune function, D. Excess keratinocyte migration. Answer C. Decreased angiogenesis and immune function. Explanation. Diabetes impairs wound healing by reducing macrophage activity, angiogenesis, and fibroblast function, leading to chronic ulcers. Tissue repair. Fibrosis and chronic injury. A 58-year-old man with chronic hepatitis C undergoes a liver biopsy, which reveals fibrosis and collagen deposition. Which cell type is primarily responsible for this fibrotic process? A. Kupffer cells, B. Hepatic stellate cells, C. Endothelial cells, D. T lymphocytes. Answer B. Hepatic stellate cells. Hepatic stellate cells, when activated by TGF-B, produce excessive collagen, leading to liver fibrosis and chronic inflammation. 7. Granuloma formation, casus necrosis. A 43-year-old immigrant presents with a chronic cough, weight loss, and night sweats. A lung biopsy shows central casus necrosis surrounded by macrophages and giant cells. What immune process led to this lesion? A. Immediate hypersensitivity, B. T-cell-mediated granuloma formation, C. Antibody-dependent cytotoxicity, D. Complement activation. Answer B. T-cell-mediated granuloma formation. Explanation. T1 cells secrete IFN-Gang, activating macrophages to form granulomas, which sequester Mycobacterium tuberculosis but also cause casus necrosis. 8. Complement activation in bacterial infection. A 10-year-old boy with a Neisseria meningitidis infection is found to have a deficiency in C3 complement protein. Which of the following immune functions will be most affected? A. Neutrophil migration, B. Opsonization and bacterial clearance, C. T-cell activation, immunoglobulin class switching. Answer B. Opsonization and bacterial clearance. Explanation. C3 deficiency impairs complement-mediated opsonization, reducing bacterial clearance and increasing susceptibility to encapsulated bacteria. NR9. Wound healing, collagen type, and scar formation. A 32-year-old man has a deep skin laceration that heals with a visible scar. Which type of collagen is most abundant in the mature scar tissue? A type 1, B type 2, C type 3, type 4. Answer: explanation. Type 1 collagen is the predominant structural component in mature scars, replacing type 3 collagen during the final remodeling phase of wound healing. 10. Keloid versus normal scar formation. A 25-year-old woman develops an excessive raised scar following an ear piercing. The scar extends beyond the original wound boundaries. Which process is responsible? Excess collagen type 1 deposition, B, excess collagen type 3 deposition, C, insufficient collagen remodeling, D, decreased fibroblast proliferation. Answer: B, excess collagen type 3 deposition. Explanation: keloids result from excessive fibroblast activity, leading to increased type 3 collagen deposition beyond the wound margins. Key takeaways for inflammation and tissue repair. Acute inflammation. Neutrophils are first responders. Histamine increases vascular permeability. Chronic inflammation. Macrophages and T-helper cells, Th1, Th2, drive responses, e.g. granulomas in TB. Leukocyte migration. Rolling, selectins, adhesion, integrins, diapedesis, and chemotaxis. Wound healing phases: inflammation 0 to 3 days, neutrophils, macrophages, proliferation 3 to 14 days, fibroblasts, collagen III, angiogenesis. Remodeling, weeks, months, Collagen I replaces collagen III in scars. Keloids, excess type 3 collagen, beyond wound borders. Diabetes and impaired healing, decreased angiogenesis, fibroblast dysfunction, and immune impairment.